Hi, how's everyone doing today? My name is Ador Mansat, and I am excited to present to you my Doctor of Nursing Practice capstone project on the combination use of semaglutide and intermittent fasting for weight loss. So here goes. Obesity is a major health concern, especially in developed countries like the United States. According to the World Health Organization, approximately one third of the US adult population is now classified as obese. This alarming statistic paints a sobering picture of the widespread nature of the problem. The consequences of obesity go far beyond individual health, impacting the broader dynamics of community healthcare. Specific regions or communities like my home state, California, might be more at risk than other states, highlighting the need for tailored interventions. Individuals with obesity face not only physical health challenges but also psychological strains, societal hurdles, and sociocultural impediments, such as weight stigma. These additional burdens can make it difficult for them to manage their weight effectively. The persistent rise in adult obesity rates underscores the crucial role that healthcare professionals like us, especially nurses like us, play in both prevention and intervention. By providing education, support, and resources, nurses can empower individuals to make healthy choices and manage their weight, and ultimately contributing to a healthier and more resilient community. This study investigates the combination of semaglutide, a medication initially developed for diabetes, and intermittent fasting combat to combat obesity in a specific Southern California population. The need for this research arises from the limitations of traditional weight management approaches like diet and exercise. While these methods may be effective for some, many people struggle to achieve lasting results. So, this study aims to explore whether combining semaglutide and intermittent fasting can offer a more effective solution for individuals who haven't achieved desired results through traditional methods. So by using the PICO model, the research will be conducted in a rigorous and systematic manner, contributing to the clinical understanding of weight management and potentially influencing standard of care practices for obesity in non-diabetic individuals. This study focuses on non-diabetic adults aged 18 to 64 years olds with a body mass index of 25 to 39 who haven't seen results with traditional diet and exercise. We want to see how combining semaglutide and intermittent fasting impacts their weight loss compared to semaglutide alone over a 2-month period. Specifically, we'll be measuring percentage weight loss and improvements in body mass index or BMI. So let's break down the PICO question. P for population, who are we studying? These are the non-diabetic adults aged 18 to 64 with a body mass index of between 25 to 39, not responsive to conventional diet and exercise. I or intervention, what are we doing? We're combining semaglutide and intermittent fasting for weight management. So C for comparison, what are we comparing it to? We're comparing semaglutide alone with O, the outcome. What are we measuring? The percentage weight loss, the BMI improvement, and T for time, how long will the study last? So it'll be a 2 months period. So by using this PICO framework, we can conduct a focused and scientifically sound investigation into the potential of this combined approach for weight management in this specific population. This first literature review slide highlights two studies. These two studies were reviewed to explore the effectiveness of semaglutide and intermittent fasting for managing weight. So the first study, conducted by Harris et al. In 2018, analyzed data from 40 studies and found that individuals undergoing intermittent fasting experienced greater weight loss than those with constant calorie restriction or no intervention at all. So this suggests that incorporating IF or intermittent fasting into weight management plans could be beneficial for overweight and obese adults. The second study, led by Wilding et al. In 2021, was a randomized controlled trials or RCTs where individuals with overweight or obesity were randomly assigned to receive either semaglutide injections alone or a placebo alongside lifestyle modification for 6 to 8 weeks. The results showed that those taking semaglutide achieved significantly greater weight loss, about 14.9%, compared to those taking the placebo, which is only 2.4%. So this suggests that using semaglutide may be a valuable addition to treatment plans for individuals struggling with overweight and obesity. So based on these two studies, both IAP and semaglutide seem to be effective options for weight management in overweight and obese individuals. However, further research is needed to assess the potential benefits and risks of combining these interventions. So two more studies, in addition to the two that we just presented in the first literature review slide. This second slide for our literature reviews, two more studies were reviewed to explore the effectiveness of semaglutide in intermittent fasting for weight management. The first study by Johns and Associates in 2016 compared the effects of minimal intervention with active dietary and exercise interventions in individuals with obesity. They found that those in the low intervention group gained weight on average, highlighting the need for more effective approaches to manage obesity. The second study by Patterson in 2017 focused on the potential benefits and mechanism of intermittent fasting. This review found that IF may offer several advantages, including improved insulin sensitivity, reduced inflammation, and effective weight loss strategies. However, more research is needed to optimize protocols for achieving these benefits and address potential disease prevention measures. So these additional studies emphasizes the limitations of low-level interventions for addressing obesity and highlight the potential benefits of IF for metabolic health and weight management. However, further research is crucial to optimize protocols and assess the long-term safety and efficacy of intermittent fasting, especially when combined with other interventions like pharmaceuticals like semaglutide. So for the next slide, we're going to talk about quality improvement or QI. It stands as a cornerstone in our efforts towards achieving a multifaceted goal. So this goal encompasses increasing population health, enhancing patient care and outcomes, lowering healthcare costs on a per capita basis, and improving the overall experience for healthcare providers. Let's delve into the various components that make up our quality improvement project. First, we focus on health policy. This involves creating and implementing policies that have a far-reaching impact on healthcare standards and practices. It's about making systematic changes that benefit the entire healthcare system. Next, we have educational intervention. This is all about empowering healthcare professionals like us through training and education. By enhancing their skills and knowledge, we can significantly improve the quality of care that healthcare providers provide to patients. So we also emphasize practice intervention. This involves changing and improving clinical practices to ensure that patient care is efficient, effective, and consistently of high quality. So another key element is the dissemination of best practices. By identifying and sharing the most effective healthcare practices, we can ensure that these beneficial methods are adopted more widely. We're also committed to the development of clinical practice guidelines or CPG. These guidelines are crucial as they help healthcare providers like us make the best clinical decisions for patient care in various clinical situations. Lastly, we focus on quality improvement as a whole. This is an ongoing process where we continuously seek ways to improve every aspect of healthcare delivery. So in summary, our quality improvement project is a comprehensive approach that combines policy development, educational initiatives, practical interventions, and the sharing of knowledge and best practices to enhance the quality of healthcare. Moving on at this point, let us explore the theoretical framework of our study. This framework is crucial in understanding the underlying principles that guide our approach to weight and obesity management. So first, let's talk about the self-determination theory, or SDT, developed by Ryan and Deci in the year 2000. This theory, a little bit a little bit dated at this time, but this theory plays a pivotal role in our understanding of motivation and psychological well being. SDT highlights three critical components: autonomy, competence, and relatedness. Autonomy refers to feeling self directed in one's actions. Competence is about feeling capable and effective in one's skills, and relatedness points to feeling connected with others. Together, these three elements foster self determined motivation and are essential for psychological well being. So, why is this important? Because these factors are key to intrinsic motivation, which Ryan, Desi, and more recently C in 2023 have linked to sustainable health behaviors. So now let's shift our focus to the chronic weight and obesity management model, or CWOMM. This second theoretical framework, our model CWOMM was elucidated by Colin and Gerard in 2022. So this is a more current theoretical framework than the earlier one from Ryan and Desi. So Colin and Gerard further was this theory was further explored by Singh and colleagues in the same year. So CWOMM, or Chronic Weight and Obesity Management Model, encapsulates comprehensive strategies for managing weight and obesity over a prolonged period. It's not just about short-term solution, but it's about sustainable change. So the CWOMM emphasizes structured and personalized approaches. These include tailored dietary plans, physical activity regimens, behavioral changes, and pharmacotherapy when necessary. So the goal here is not just weight loss, but maintaining and sustaining that weight loss over time. So in summary, both SDT, or the self-determination theory, and the CWOMM, or the chronic weight and obesity management model, provide a robust theoretical framework for our DNP study. So they help us understand the psychological aspect of motivation and well-being, as well as the practical long-term strategies for weight and obesity management. So thank you for attention. Thank you for your attention. So let's proceed to the next slide for further details. So moving on to our slide number 9, we're going to discuss the project setting and participant population for our study. The settings for our project involves two distinguished clinics in California. First, we have the Restore Med Clinic, located in the scenic Newport Beach area. The second sitting is Serenity Wellness Medicine Clinic, which one can find in Ontario, California. These clinics have been chosen for their state-of-the-art facilities and their commitment to innovative approaches in healthcare. So now let's talk about the people who are at the heart of our study, the participant population. We are focusing on a specific group here, specifically non-diabetic adults. These participants are between the ages of 18 to 64 years old and have a BMI ranging from 25 to 39. Importantly, these are individuals who have not found success with conventional weight management strategies. So this criteria ensures that our study addresses the needs of those who are most in need of alternative approaches. So by selecting this particular setting and participants, we aim to explore weight management strategies in real-world scenarios, reflecting the challenges faced by individuals who struggle with weight issues despite trying standard interventions. So thank you again for your attention. Let's prepare to dive into the next slide, where we will look into the methodologies employed in our study. So this slide number 10 presents our methodology, an essential roadmap guiding the execution of our project. So let's delve into the specifics of the setting and participants before we discuss the experimental approach. We're focusing on patients who are part of the weight management programs under the expert guidance of Dr. Heidi Regenas in her private practice clinics at both Serenity and at Restore Med clinics. These patients are engaged in a structured approach to managing their weight, and it's within this context that we're conducting our study. So to ensure a thorough and standardized entry point for our participants, we're utilizing the Medical Screening and Recruitment Survey Form, or MS and RSF form, or MSNRSF, um, this tool enables us to implement a comprehensive medical screening process, ensuring that we're working with participants who meet the precise criteria for our research. We're employing a rigorous measure of weight and BMI at two critical points before the start of the semaglutide only intervention, and then again at the end of this intervention, and then the start of semaglutide combined with intermittent fasting. That's the second intervention. And this allows us to track the progress and the impact of our interventions accurately. So we're comparing semaglutide alone versus semaglutide combined with intermittent fasting. So our methodology is rooted in quality improvement, as we mentioned earlier, specifically utilizing a pre and post-test design format. This design is pivotal as it allows us to make comparisons between the pre and post-test using both descriptive and inferential statistics, giving us a clear picture of the intervention's outcomes. Regarding our sample size, we're working with 12 participants. Time constraints and initial clinical limitations led to these 12 participant volunteers. In summary, our methodology is designed to provide a robust framework for examining the effects of semaglutide both alone and in combination with IF on weight management in our selected 12 participants. So these are the 12 volunteer participants that we can get from the two clinics. Actually, most of them be from Serenity Clinic. So as we proceed to our slide number 11, it's focused on the tools utilized in our research or in our study. As an accurate and consistent approach to data collection is paramount, and for this, we have employed several data measurement instruments or DMIs. These instruments are critical for ensuring that the data we collect is reliable and valid. The data measurements we're concerned with will include weight, height, and BMI. These are key metrics in our weight management study. Let's break down each of these. So weight is the body mass of the participant, which we measure in kilograms. This is a fundamental metric for our study as it's a direct indicator of a participant's progress. BMI or body mass index is a derived measurement which we calculate by dividing the participant's weight in kilograms by the square of their height in meters. BMI gives us a standardized way to categorize the participant's weight relative to their height, providing us with a deeper understanding of their weight status. To ensure that we measure these metrics with the utmost precision, we're utilizing a calibrated digital weighting scale for weight. So for height, we're using a stadiometer. Both these tools are known for their accuracy and are standard in clinical settings. These DMIs for weight, height, and BMI are fundamental to our methodology as they provide the quantitative data that we need to analyze the effectiveness of our intervention. So in summary, the tools we've chosen are designed, so these are the calibrated weighing scale and the stadiometer. These are both designed to provide us with precise and standardized data, enabling us to conduct a rigorous and repeatable and reliable study. With the right tools in hand, we can confidently move forward with our research or with our study. So now let's proceed to the next slide where we will explore the data collection in greater detail. As we turn to our slide number 12, we're going to discuss our data collection process in detail, a critical phase that lays the foundation for the integrity of our research findings. Let's start with the pre-test and education phase. Before administering the first weekly subcutaneous dose of semaglutide, we meticulously recorded each participant's initial weight, height, and body mass index right at the clinic. This initial data collection is pivotal as it sets the baseline against which we will measure all future changes. So additionally, we conducted an educational session. Participants were thoroughly appraised of the treatment protocol, its mechanism, and the potential advantages of the intervention. They were also provided with informational brochures and materials, ensuring that they were well informed about the potential benefits and side effects of semaglutide and making sure that all their questions are satisfactorily answered. Moving on to the post-test and evaluation phase, after 12 weeks or 2 months, after 8 weeks, we conducted a post-test assessment. Here we measured and recorded the participants' weight and BMI once again, and this post-intervention data is essential for us assessing the efficacy of the treatment. We also collected qualitative feedback as an aside, capturing participants' experiences with the treatment. So, speaking of quantitative changes, our quantitative analysis involved the data collected from both the pre-test and the post-test stages. This data was then scrutinized using appropriate statistical tests to draw meaningful conclusions from the numbers. Lastly, we ensured that confidentially and ethical confidentiality and ethical considerations were upheld throughout the research process. All participant data was kept strictly confidential. We anonymized all forms, measurements, and feedback using unique identification codes. This ensured that personal identities were not revealed during the data analysis or any dissemination phases of our research. In summary, our data collection process was comprehensive, methodical, and ethical, providing us with a robust data set for analysis. With this in place, we can move forward confidently with interpreting our results. Now let's advance to the next slide where we will delve into the results and findings of our study. So for this slide, we explore the descriptive statistics that summarize the data from our study. These statistics are fundamental to understanding the patterns within our data and will guide us in interpreting the efficacy of our interventions. Let's begin with a glance at the median and the standard deviation values for the weight and BMI of participants at various stages of the study. We observed that the median weight at the start of the semaglutide-only intervention was 188 pounds, with a standard deviation of 35.092, ranging from 139 to 270 pounds. After the semaglutide-only intervention, the median weight dropped to 169.50 pounds, indicating a potential effectiveness of the treatment. Similarly, the median BMI at the start was 31.5, which subsequently decreased to 29 after the semaglutide-only phase. As we combined semaglutide with intermittent fasting, there was a further reduction in both weight and BMI, with the median weight decreasing to 157.5 pounds and the median BMI to 27. Now let's discuss the Shapiro-Wilk test, which we use to test the normality of our data distribution. The results are crucial as they impact the selection of subsequent statistical tests. For most values, the significance value is greater than 0.05, which implies a normal distribution. However, the Shapiro-Wilk test indicates that the BMI at the end of semaglutide only and the BMI at the start of semaglutide with intermittent fasting did not follow a normal distribution, as their significance values were less than 0.05. So importantly, the median values for all our variables have shown a decrease from the pre-test to the post-test, which suggests a potential effectiveness of the interventions that we've implemented. So in conclusion, our descriptive statistics provide a snapshot of the data's central tendency and variability, and the normality test shape our approach to further inferential analysis. This slide on the descriptive and statistical analysis lays the groundwork for the inferential statistics that we will discuss in the next slide, which will then allow us to draw more definitive conclusions about the impact of our interventions. Let's proceed to the next slide to continue our examination of the results. So this next slide presents the analysis of the change in weight and BMI before and after the use of semaglutide only. We are using the Wilcoxon signed rank test. This is a non-parametric test that helps us understand the significance of the changes observed in our participants. Remember, we have to use the non-parametric right now because the test, well, number one, n is less than a more desirable 30, the number of participants, plus we do not have a consistently normal distribution for our data. So now let's dive into the weight changes first. We had a total of 12 participants, and when we look at the ranks of the weight differences, we find that all 12 showed a negative rank. So this indicates that so that's the non-parametric data there. So it's we're ranking. So that's the type of non-parametric data that we're using. So this indicates that for all participants, the post-test weight was lower than the pre-test weight. So the mean rank here was 6.5 with a sum of ranks at 78. The z-value was calculated to be negative 3.062 with a significance level of 0.002. What does this mean? With a significance level well below our alpha of 0.05, we reject the null hypothesis. So this implies that there is a statistically significant reduction in weight after the use of semaglutide only within our participant group. So moving to the BMI changes, we see a similar pattern. Again, we have 12 participants with negative ranks, a mean rank of 6.5, and the same sum of ranks of 78. So the z-value here is negative 3.086. Also, we get significance level of 0.002. Just as with the weight, the significance level for the BMI change is also well below the alpha threshold of 0.05, leading us to reject the null hypothesis in favor of the alternative hypothesis. This indicates that the reduction in BMI after the use of semaglutide only is statistically significant. In conclusion, both the weight and the BMI of participants showed significant reduction post-intervention with semaglutide only. The data from the Wilcoxon rank test confirms the effectiveness of semaglutide in managing weight and BMI in our study's context. This slide reinforces the potential of semaglutide as a viable intervention for weight management. Now let's continue to the next slide to explore further insights from our study. So for our slide number 15, we'll examine the change in weight and BMI before and after the use of the combined intervention semaglutide and intermittent fasting, or IF. So here we present the results again from the Wilcoxon signed rank test, which is crucial for assessing the effectiveness of this combined intervention on our participants' weight and BMI. So we're using Wilcoxon signed rank test, okay? So starting with weight, so it's the same analysis we used for the first intervention. Now we're using it for second intervention. Starting with weight, our analysis includes data again from those 12 participant volunteers. And looking at the ranks, we see that all participants had negative ranks, meaning every individual showed a decrease in weight after the intervention. So the mean rank was consistent at 6.5 with the sum of ranks totaling 78. So the Z-rank value the Z value is negative 3.084 with a significance level of 0.002. Again, what does this indicate? With the p-value standing at 0.002, which is considerably less than our alpha of 0.05, we decisively reject the null hypothesis. This result supports the acceptance of the alternative hypothesis, affirming that the combination of semaglutide and intermittent fasting significantly reduces weight. And moving on to BMI, we see a similar trend. Again, with the 12 participants showing negative ranks, the mean rank remains 6.5. The sum of ranks is 78. The z-value here is slightly higher at negative 3.166. And yet the significance level is again 0.002. So as with the weight, the BMI results are statistically significant, leading us to again reject the null hypothesis in favor of the alternative, which is reinforcing that this statistical finding affirms that combining semaglutide with intermittent fasting has a significant impact on reducing body mass index. So in summary, the data from the Wilcoxon signed rank test clearly demonstrates that combined use of semaglutide and intermittent fasting is effective in reducing both weight and BMI among participants. These significant findings underscore the potential of this combined approach as a potent intervention for weight management. So as we look at slide number 16, we arrive at the outcome of our study, which encapsulates the findings of our interventions with semaglutide both alone and in combination with intermittent fasting, or IF. Firstly, we address the weight of non-diabetic adults using semaglutide alone. The data led us to reject the null hypothesis that posited no statistically significant difference before and after the intervention. Instead, we accept the alternative hypothesis, confirming that there is indeed a statistically significant difference in weight due to semaglutide use. Secondly, regarding BMI changes with semaglutide alone, we see a similar outcome. The null hypothesis, which suggested no significant difference, is rejected. We accept the alternative hypothesis, acknowledging a statistically significant difference in BMI after using semaglutide alone. Thirdly, when evaluating the weight of non-diabetic adults before and after using semaglutide in combination with IM, our findings again lead us to reject the null hypothesis. The alternative hypothesis is accepted, indicating a statistically significant difference in weight due to the combined intervention. Lastly, for BMI changes with the combination of semaglutide and IF, we draw the same conclusion. The null hypothesis is rejected in favor of the alternative, which affirms a statistically significant difference in BMI following the combined treatment. So in summary, our study has shown significant evidence that both semaglutide alone and in combination with intermittent fasting can lead to meaningful differences in weight and BMI among non-diabetic adults. So these outcomes provides valuable insights into the efficacy of these interventions, offering a promising direction for weight management strategies. Let's proceed to summarize the findings in the next slide. So let's synthesize the findings of the study for our DNP capstone project. The core message from our research is that semaglutide, applied both alone or individually and in conjunction with IF, has proven to be both effective for short-term weight loss in non-diabetic adults. Interestingly, the findings also indicate that the combination approach where semaglutide was paired with IF did not yield significantly superior results when compared to semaglutide alone. Within the 2-month time frame of our study, this is a crucial insight as it challenges the initial assumption that combining these two strategies could probably naturally lead to better outcomes. So the outcome of our research may point towards possible limitations. One such limitation could be the duration of the study. 2 months may not be an adequate length of time to observe the full potential benefits of combining semaglutide with IM. Alternatively, the limitation could lie in our sample size. We only got 12 volunteers, again because of time constraints and some initial limitations with one of our sample clinical site. So with more participants, we might be able to observe different results or be able to draw more robust conclusions. And again, because of a smaller sample size and the fact that the curve is not really normal and it's skewed, so we had to use, instead of the normal paired t-test for a normal distribution, we also had to use the Wilcoxon rank test. So these considerations are vital as they inform future research directions. They suggest that we should explore longer study durations and possibly larger sample sizes to fully understand the long-term effects and potential benefits of combined treatment approaches. So in conclusion, our findings provide a valuable contribution to the ongoing exploration of effective weight loss strategies. The evidence points to the effectiveness of semaglutide and opens the door for further investigation into how it can be best utilized in weight management. So again, in combination with intermittent fasting. So now let's advance to the next slide because we need to discuss the implications and future recommendations based on our study's outcomes. So let's look at the DNP essentials first. So this framework provides a comprehensive approach to our doctoral nursing practice education. It's integral to our professional and scholarly foundation. So with Essential 1, scientific and underpinning, our project was deeply rooted in the scientific evidence gathered from the clinical data. We embark on this research or this study with a quality improvement project study with a robust understanding of the biological, physiological, and behavioral sciences that underpin the practice of nursing. Moving to essential number 2, organizational leadership and systems thinking, we apply these concepts through our work with private health clinics to coordinate the project. The use of semaglutide in our study also addressed the sociocultural stigma faced by patients with obesity, showcasing how organizational leadership can impact patient care and societal attitudes. So for essential number 3, clinical scholarship and analytical methods, we've embraced a rigorous scholarly approach by collecting pre and post data and utilizing descriptive and inferential statistics for analysis. We contributed to the clinical scholarship with our analytical methods. Regarding Essential 4, in a professional collaboration, our project was a testament to the power of teamwork. We work closely with with the clinical facility, with of course with our faculty, Dr. Deborah Terry, and our clinical preceptor, Dr. Heidi Reginas, and professionals in nursing, in the nursing clinic, in the medical clinic that we work with, who can now consider adopting semaglutide to aid their patients based on our findings. So our research supported previous studies on the effectiveness of semaglutide for weight loss. However, it challenged the notion that intermittent fasting would significantly enhance the decrease in weight when combined with semaglutide within the short time frame of our study. In summary, our project not only adhered to but exemplified the DNP essentials, weaving together scientific evidence, leadership, scholarship, and collaboration to advance the practice of nursing. Let's proceed to the next slide, where we will outline our recommendations and potential areas for further research and the weakness. So let's go back there. Let's start with the strengths. One of the key strengths of our study is the significant results we obtained from all the pre and post tests. These results clearly demonstrated that weight and BMI decrease as a result of the intervention with semaglutide, both alone and in combination with IF. Additionally, our intervention was grounded in existing literature, so our LR actually is consistent with our result, ensuring that our approach was informed by previous research and best practices. Now, turning to the weakness or the limitations, our study did have a few notable limitations. The first one, obviously, is the small sample size, which could limit the generalizability, generalize, oh my gosh, generalizability of our findings. So the way we can generalize our findings. So secondly, the limited study duration might have restricted our ability to observe long-term effects of the interventions. And thirdly, our study did not include gender differences in its design, which could be an important factor in understanding the effectiveness of the interventions. In terms of constraints of the project, we faced time constraints. The limited duration available for conducting the research impacted various aspects of the project, including the scope and depth of the study. As for future recommendation based on our experiences and findings, we suggest that future studies should aim to measure gender differences. This could provide more nuanced insights into how the interventions impact different genders. Additionally, extending the study over a longer period could help in observing the long-term effectiveness and sustainability of the interventions. And finally, of course, increasing the sample size would enhance the reliability and generalizability of the results, quite a tongue twister there, and allow for more comprehensive statistical analysis. So again, in conclusion, while our study has its strengths and yielded significant findings, recognizing its limitations and constraints opens avenues for more extensive and inclusive research in the future. So as for sustainability, this is an essential component as it speaks to the potential of our research to have a lasting impact and to be built upon in the future. So first, it's important to note that this project is replicable. It's simple enough, and this means that the methodology and approach we've used can be simple enough to be duplicated in other settings or studies. The replicability is crucial for the validation of our findings and for the advancements of knowledge in the field of weight management and obesity care. Secondly, the follow-up project is achievable. Based on the insights and data we've gathered, there is clear pathway to continue this line of research or study. A follow-up project could delve deeper into certain aspects of our findings or explore new related questions. Furthermore, the outcomes of this investigation will be utilized as a foundation for subsequent achievement or enhancement of care for patients with obesity. This implies that our findings have practical implications that can inform clinical practice and improve patient outcomes. Finally, we recommend that future research should be conducted to determine the effects of the strategy selected on different genders and among different communities. This would help us understand the broader applicability and effectiveness of our intervention strategies and ensure that they are inclusive and effective for diverse populations. In summary, our project's sustainability lies in its potential for replication, the feasibility of follow up studies, its practical implications for enhancing patient care, and the scope for further research to explore its effectiveness across different demographics. As we continue this presentation, let's remember that the journey of research and discovery is ongoing, and our project paves the way for future exploration. So let's move forward to the final slide to wrap up our discussion. So this involves our dissemination plan, which is another critical step in ensuring that the valuable findings from our project reach the relevant audiences and have a tangible impact. First and foremost, we plan to publish the results of this project in a scholarly research journal. So the Journal for Nursing Practice, which is a Philippine, um, it's a publication of um, a nursing society mostly comprised of um, Filipino nurses. So, but not limited to them, obviously. So, this is a vital step in contributing to the scientific community and adding to the body of knowledge in the field of weight management and obesity treatment. Publishing in a peer reviewed journal like JNPAR um, not only validates our findings but also makes them accessible to researchers and practitioners worldwide. Next, we intend to share the results with healthcare professionals. This is an essential part of our plan, as these are the individuals who can directly implement our recommendations and take informed decisions in clinical settings. By disseminating our findings to healthcare providers, we aim to influence practice and improve patient outcomes based on the evidence we have gathered. Finally, our findings will be shared with academicians. This is particularly important for the replication of the study. By providing academicians with access to our research, we encourage further exploration and validation of our findings. This could lead to new studies, potentially on a larger scale or in different settings, which can enhance our understanding of the effectiveness of interventions like semaglutide and IF in weight management. So, in summary, our dissemination plan is going to be multifaceted, targeting the scientific community, the healthcare professionals, and academicians. Through these channels, we aim to maximize the impact of our DNP capstone project and contribute to improve healthcare practices and outcomes in general. So as we conclude this presentation, the next slide shows the references used in using the 7th edition APA format. So here's here's a second slide showing more references. And then for our final slide, here's the DNP poster, which is a major tool for dissemination of these studies, of this DNP study. So thank you for your attention throughout this presentation. And as I promised at the outset of my presentation, let us now open the floor for any questions or clarifications. Any questions? Thank you so much. Make it a wonderful day.